Good morning. It's great to be in Surrey. It's great to be here on the territories of the Kwantlen, of the Katzie, of the Semiahmoo, of the Coquitlam First Nations. It's great to be here today on this rainy day, which I think we needed. So I like that. But it's wonderful to be here with outstanding guests. The Premier of BC is here, the Honourable John Horgan, and I never tire of saying that, Premier. Never tire of saying that. That's pretty cool. The medical director and lead of the BC Cancer Agency, Dr. Kim Nguyen Chi, is here, and we are delighted to have him here. The president, the outstanding president of the Fraser Health Authority, Dr. Victoria Lee, is here, and we're going to be proceeding with an announcement today, and it's my honor to introduce the Premier of British Columbia, the Honourable John Horgan. Come on in.
Thanks, Adrian, and thanks everyone for being here today. I want to also acknowledge the territory of the Coast Salish people, as Adrian has done, and also to thank him for his work over the past number of years as Minister of Health. Critically important to all of us is our personal well-being, the well-being of our families, our communities, and of course our province. And Adrian's leadership, as well as that of health authorities across British Columbia, particularly during a time of pandemic, has been inspirational to so many people. And although we have many miles to go, we have come a good distance over the past 5 months with positive results. And we're hoping to continue that going. We have to trust in our medical system. We have to make sure that we're doing everything we can to address the illnesses that emerge, whether they be issues like COVID-19 or whether it be cancer, which has touched so many of us right across British Columbia. Myself, I'm a cancer survivor. I had a bladder cancer experience 12 years ago and a recurrence 6 years after that. And I know the hard work of oncologists and the cancer clinics here in the Lower Mainland, as well as in Victoria and other parts of the province, do extraordinary work every day. And we're fortunate that we rank among the best in the world when it comes to cancer outcomes. For almost 3 years now, we've been working as best as we can to improve those already positive outcomes. And while there are new treatments every day and every corner creates a new opportunity, we need to be prepared and we need to make sure that we're making investments, strategic investments, in the public health and well-being of British Columbians, and that's why we're here today. I'm proud to announce that a new regional BC Cancer Treatment Centre will be part of the new Surrey Hospital here in Cloverdale. Half of British Columbians will be diagnosed with cancer in their lifetime. And many of those cases will be right here in Fraser Health, the fastest growing part of British Columbia. Nothing is more important than the health of our family, the health of our loved ones. And when dealing with cancer, to know that there's a clinic populated by the best possible healthcare providers in the world in your neighborhood is very, very positive news for everyone. The new Surrey Hospital, which is at the concept planning stage now, will have this cancer center added to it, making it a significant investment here in Fraser Health. And I know Dr. Lee will be talking about that, as well as Dr. Chi, on the importance of having a cancer clinic here in the Fraser Health Authority. And we've been making improvements not just in cancer treatment, not just in the delivery of other services, but we've been seeing a rebound in our elective surgeries. Minister Dix, regrettably, when we made the decision, we both talk about that quite frequently, when the pandemic hit, the toughest decision that we had to make was canceling elective surgeries for people right across the province. But we've seen a very positive rebound because of the commitment of healthcare workers, doctors, ER nurses, operating room nurses, and others in the system to make sure that we can bounce back as quickly as possible. New MRIs, new other diagnostic treatment capacity across the province also leads to better outcomes. And in conclusion, I just want to thank all of the healthcare providers who have been on the front lines over the past number of months, and indeed over the past number of years, making British Columbia the envy of Canada when it comes to delivering services, making British Columbia the envy of Canada when it comes to treating cancer. And with a new cancer clinic, a cancer center here at the new Surrey Hospital, Fraser Health is in very, very good hands. Thank you.
Good morning, everyone. I'd like to thank the Honourable Premier Horgan, Honourable Minister Dix, and the Government of British Columbia for bringing us together today for this very exciting announcement. It's a real pleasure to be speaking today on behalf of BC Cancer and the Provincial Health Services Authority. We are very excited to partner with the Ministry of Health and Fraser Health on this important project. As Premier Horgan mentioned, Surrey is one of the fastest growing communities in Canada, and with that, the incidence of cancer will continue to grow. By 2027, it is expected that there will be a 50% increase in the number of people being diagnosed with cancer. In the Fraser Health region, this will represent 1 in 3 of all the new cancers that are diagnosed across BC. Opening a second BC Cancer Regional Centre in Surrey will help BC Cancer, PHSA, and Fraser Health better serve the needs of the community as we prepare to meet this rising demand. The new Surrey Cancer Centre layout will facilitate the transformation of cancer care to a more patient-centred approach by focusing care around the patient with team-based care, multidisciplinary clinics, and enhanced digital health facilities. The new centre itself will be a state-of-the-art and bring the latest in technology and modern cancer treatments to our patients in Surrey. This centre will host the largest precision radiation therapy program in the Fraser Health region. In a first for the Fraser Health region, the centre will also feature a state-of-the-art functional imaging and treatment centre with 2 PET CT scanners, a cyclotron, and a targeted radiopharmaceutical program. Throughout this COVID-19 pandemic, the burden of cancer on our patients has not stopped, and cancer care has continued throughout the province. Increased use of digital health or virtual health is one example of how we have adapted to keep our patients safe and our staff safe as well. But also it provides a means to bring care directly to patients in their own homes. The new Surrey Cancer Centre will be designed and staffed to optimize digital tools like this to deliver care more effectively, safely, and conveniently for our patients. I'd like to personally thank the teams and medical professionals at BC Cancer and Fraser Health who have come to work together collaboratively over the past many months to plan this new cancer centre. So on behalf of BC Cancer, all our staff and physicians, our thanks to Premier Horgan, Minister Dix, PHSA, and Fraser Health for their support for our cancer patients with today's announcement. Thank you very much.
Good morning, everyone. Thank you for being here. And I'd like to start by thanking the Premier and the Minister, Dr. Chi, for their comments and their commitment to investments and growing healthcare in Surrey. I also like to acknowledge the phenomenal leadership that the Premier and the Minister have provided the province over the very, very difficult, challenging times and over the ongoing COVID-19 response as well. So Fraser Health is the most populous and the fastest growing health region in British Columbia, serving 1.8 million people across the province. And Surrey is the largest community in our region and will be overtaking Vancouver in the next couple of decades as the most populous municipality in the province. And as mentioned, cancer hits 1 in 2 British Columbians, and 1 in 3 of those will be in the Fraser Health region. So the integrated cancer centre in the new Surrey Hospital will put our patients and their families first by ensuring that patients that have not only cancer diagnosis, but those that suffer from cancer as well as diabetes, heart disease, get an integrated care from screening, diagnosis, to treatment, to palliation. What I'm very excited about is the fact that we have an opportunity with the new Surrey Hospital to design and ensure that we put all of those family and patient and clinician perspective into place to fully develop a comprehensive care for our growing community in Surrey, but not only for those people that are in Surrey, but across the region of Fraser Health. The new Surrey Hospital will not only have its physical infrastructure, but will also have a fully digital community component as well, for the inpatient, ambulatory, and support services within Fraser Health Authority. And again, by partnering with PHSA, BC Cancer, we'll be able to look up both precision medicine as well as innovative, purpose-built approach to cancer care to provide our patients, families, and providers with seamless as well as convenient integrated care. Our goal, of course, is to provide people that are living and working in Surrey and the surrounding areas with the excellent services that they have today, but also meeting growing needs for many people to come for the decades to come as well. And then I firmly believe that the addition of the Cancer Centre to the new Surrey Hospital will meet that demand. So thank you again to all of the teams, both at PHSA, Fraser Health, and BC Cancer that have been working together to work on the business plan that will be coming together. And thank you so much again to the Minister and the Premier for your ongoing investment and support in Fraser and also in Surrey.
Thank you, Dr. Lee. I just want to say how extraordinary it is to have leaders in healthcare like Dr. Victoria Lee, like Dr. Kim Nguyen Chi, who are in some ways a new generation, but have taken over leadership of two very important institutions for people in BC, the Fraser Health Authority and the BC Cancer Agency, and are doing just an exceptional job. And they are extraordinary doctors as well as extraordinary health leaders, and we're really honored to have their leadership. I wanted to say a few things about the Second Surrey Hospital and the role that the new Cancer Centre will play in it. As you will know, back before the new government was elected, Premier Horgan committed to a second hospital for Surrey, and it had been long talked about. And his direction to me as Minister of Health, the day that I started as Minister of Health, was to make it happen. And so in December 2017, we started the concept plan process. There had been nothing and no plan in place for a second Surrey hospital. And that work was significant, and it provided an opportunity. We are delivering, as you know, new hospitals all over British Columbia, particularly the north and in the interior. But the Surrey Hospital, it was unique in that it wasn't replacing a hospital or adding to an existing hospital. All those hospitals have been built in the 50s and 60s. But the new Surrey Hospital was going to be a new hospital, a new site meeting the demands of the fastest growing community, the most dynamic, the youngest community in BC, which was Surrey. And so in December 2019, we announced the approval of a concept plan that we were going ahead, that it was in the 10-year capital plan. But what was unique and what we learned in that process was the fact that Surrey, while the youngest now, was also going to have the largest increase in the number of people with cancer in BC, and that this was an opportunity to fully integrate a new cancer centre into a new hospital in a way that we hadn't done before. It was an extraordinary opportunity, and I think what Dr. Chi and Dr. Lee spoke of is that opportunity. So the announcement today is significant, to deliver on that announcement here in Cloverdale, here in Surrey, to say that this is the direction we're going in, shows that this is one of the most significant healthcare projects of this century that we're announcing here, that it has come out of that direction from the Premier, and we're very proud of it. We're very proud of the other things we're doing in Surrey, the existing work by the existing Cancer Centre at the Surrey Memorial Hospital, the two new urgent and primary care centres in Surrey, the two new MRI machines in Surrey, the new Indigenous primary care centre that started in 2019 in Surrey, the new mental health urgent care centre at the Surrey Memorial Hospital. All of these demonstrate our commitment to improving healthcare in Surrey, the increase in staffing at every long-term care home in Surrey. And all of this has been reflected in the response of public healthcare to COVID-19. So what we're announcing today, I think, is speaks to the future of healthcare. We know from this time of COVID-19 how central healthcare is, but all of us know who live in this province the central part that dealing with cancer is in the lives of people across BC. And this speaks to that need. The fact that we are living longer, especially living longer after 65, means that there will be more age-related cancer in the future, and how we deal with that as a society will speak to the kind of public health care system we have. And that's why I'm so proud of our leaders today, our healthcare leaders, who have said this is an opportunity for us to come forward to build a better healthcare system, one that's more compassionate, that deals not just with the extending of life, but its quality of life. And providing cancer care services in communities near where people are is part of that. So I am so proud to be part of this announcement today, so proud of the Premier, so proud of this new cancer center in this new hospital that will make a difference for coming generations of people who live in Fraser Health, who live in Surrey. And this is part of an integrated effort and capital plan of the Fraser Health Authority. We know of the project at Peace Arch Hospital, serves many people in Surrey, but in White Rock, of course, as well. The new project at the Langley Memorial Hospital that does the same thing. The new project just across the bridge just opened for mental health and addiction services at the Royal Columbian Hospital. All of these things demonstrate that we need to, what we're doing to prepare and to build a public health care system of the 21st century that everyone in BC can be proud of. So thank you very much, and I'm now honored to welcome the Premier back to the stage to take questions about this project and perhaps one or two other things. Thank you very much.
A quick reminder to reporters on the line, please press *1 to get in the queue for your questions. If you've already press it again just to ensure I see your name in the queue. Our first question today is going to be from Richard Zisman.
Premier, I'd like to ask you about the back-to-school plan. We haven't had an opportunity to ask any questions about it since it was announced to you since last Wednesday. Do you support the calls from now the principals and vice principals and the BCTF to push back the start of school in order to ensure that everyone's prepared?
Well, I know that this is the biggest challenge that the education community has ever had. In 100 years, we've not had to experience going back to school in September during a global pandemic. And I know there's anxiety within the workforce, within the parent community, and even with some children. Of course, this is a very stressful time. But I'm confident that the steering group, which consists of administrators, vice principals, principals, teachers, support workers, parents, trustees, are all working to focus on making sure that we can get this right. And the first few days of the year of school, as you all remember from your own experience or the experience of your children, is always a time of flux. And I believe that going into this September, we need to be more flexible than ever before. And I know that community leaders in the education sector will be focused on that, making sure that they're doing everything that they can to make sure children are safe, the people that work in schools are safe. And I'm confident that as we evolve through the plan into September, October, and into November, and then into the spring, it will be different when we finish than it was when we started. But we need, as with every journey, we need to take that first step. And I'm confident that the time frame that the ministers put in place with stakeholders is going to be effective. Remembering, of course, that every school is different, every community is different, and that's why we need to leave those decisions at the end of the day to the people in classrooms, to the people in the schools of British Columbia.
Richard, do you have a follow-up?
I do. I'd also like to ask about Haida Gwaii. When I spoke to you about this about a month ago, before there were travel restrictions, I asked about the fishing lodges and concerns from the community, and you said the lodges were quite a far way away from where the population was, and that they had followed all the rules like any business in British Columbia. What do you say to those lodges that have now been forced to close, expected for the entire rest of the summer, due to the overall closure of the community? And could there not have been some special accommodations made, considering the distance of those lodges away from where we're seeing this current outbreak in Haida Gwaii?
Well, certainly a month ago there were no cases in Haida Gwaii. Now there are. It's a significant outbreak. Public health officials, emergency services personnel, as well as Indigenous leaders, non-Indigenous leaders in the community are working very cooperatively to contain that outbreak. And we've had a good first week, I think, Minister Dix? And we've got a few more weeks to go before we can declare that we've got this under control. That's our highest priority. everyone understands public safety, public health is what we need to focus on during a pandemic. To those business operators, those that are well away from the main island of Haida Gwaii, they have legitimate concerns, and we'll certainly talk to them. But public health takes the priority in this circumstance, and I'm not going to be apologetic about that.
Our next question is from Vaughn Palmer. Go ahead, Vaughn.
Hello.
Go ahead, Vaughn.
Hi. Good day, Premier. BC Hydro's latest reports on Site C show some significant uncertainties about the project, including what it will cost to fix the stability problem under the foundation, whether the project will be in service in 2024, and what it will be the total cost. With hindsight, if you'd known some of this back in the fall of 2017 when you decided to go ahead, would you have gone ahead with the project?
Well, I'm always living in the here and now, Vaughn, particularly in a global pandemic. I'm focused on the issues of today and making sure we're as best prepared for tomorrow as we can be. I'm obviously profoundly disappointed with the latest reports out of BC Hydro, and that's why the minister has put in place, as you know, Peter Milburn, a noted public servant of many decades, an engineer, as well as a former Deputy Minister of Finance under the former Liberal government. So we're hopeful that he can have new eyes to bring to bear on this question and bring that information back to government. Having said that, these are very challenging times, and working through the pandemic has been part of the problem, but there are other issues there as well, as you identified in your preamble, and I look forward to Mr. Milburn's report, and we'll be talking about that in the months ahead, I'm sure.
Do you have a follow-up, Vaughn?
Yes, please. Premier, when you decided to go ahead with this project, you also put in place some significant oversight, including a board of independent technical advisors and a committee of the board of BC Hydro itself. You've now had to send in Peter Milburn to see what's going on there. Did the oversight that you put in place, was it not enough? Did it fail, and that's why you're having to send in Milburn?
Well, we'll see what Mr. Milburn has to say. I do know that when we made the decision, you'll remember, Vaughn, the former government launched this initiative not to reduce costs for hydro ratepayers, but to get it past the point of no return. If there was one thing the former premier said once, twice, 1,000 times, that was her objective with this project. When we came to government, we inherited a range of issues, as all governments do when they're sworn in, and we did our level best to meet the public interest test, and we put in place significant oversight on this project, and it hasn't proven to be adequate at this point. Mr. Milburn will explain to us why that is.
Our next question is from Jason Hallman.
Mr. Premier, I wanted to ask you, there's a post by Mr. Mike's, the Langford station, where it talks about a large group of guests coming in and the servers being brought to tears by their actions and their treatment after being told they needed to separate. This is one of a few different restaurants we're hearing about abuse of employees by people who just aren't getting the message that they need to be kind, they need to be compassionate, and they need to be respectful of social distancing rules. I just wanted to get your thoughts and comments, being that Mr. Mike's happens to be in Langford, where it's your constituency.
Yeah, well, thanks for the question. And I had heard about this incident at a local restaurant in my community. Obviously, very disappointed that bad behavior continues before the pandemic, during the pandemic, and sadly, it will likely continue after the pandemic. Certainly, that's not how I raised my kids, and I think most people across British Columbia are horrified when they hear stories like the story coming out of Mr. Mike's. You've got employees that are doing their level best to provide an opportunity for people to come together to share a meal in a safe, comfortable place, and to have idiots come in and be idiots, quite frankly, is not acceptable. I'm very disappointed about it. I've made that clear to people in my community and right across BC. We all have to up our game. We have to be kinder to each other. We have to behave with other people as we would want them to behave with us. And it's not acceptable to abuse people when you're going out to have a meal, when you're doing anything, quite frankly. There's a whole host of stories that are emerging about bad behavior. during this pandemic, and unfortunately they overshadow the extraordinary stories of kindness that are emerging in every part of British Columbia as well. I'd like to focus on those moments when people's better angels are shining forward, rather than those moments like the Mr. Mike's incident when people are just being stupid.
Do you have a follow-up, Jason?
I don't. Thanks, Jen.
Our next question is from Ian Bailey.
Oh, hello, Premier. You said that there's a flexibility in dealing with the school system and reopening the schools, but just to sort of pin down on one point, are you prepared, is BC prepared to delay the reopening of the school year, as things develop here?
Well, certainly, Ian, thanks for the question. And I think the key part of that question is as things develop. We know that parents, students, teachers want to get back in the classroom. We also know that parents, students, and teachers are anxious about that. I have family members. My daughter-in-law is a teacher here in British Columbia. My son is a teacher in another jurisdiction. So I understand directly how educators feel. And as a parent, I understand the anxiety that other parents are feeling. But I also know that we need to focus on getting back to as near to normal as we possibly can. And our education system involves hundreds of thousands of people, and we need to find a way for all of that to happen in a safe manner. And that's what we're focused on. And we've had unprecedented discussions with all of the stakeholders. We'll continue to do that. People will disagree. There's no question about that. But the vast majority of people want to make sure we get this right. And if it takes a few more days, so be it. But today, we're focused on starting the school year as we had planned, making sure that we have provisions in place to protect workers, to protect children, and to make sure we get as safe a start as possible.
Do you have a follow-up, Ian?
Yes, I do. Premier, can parents expect that a portion, perhaps a significant portion, of their children's school term will be spent online and not in the classroom?
That's going to vary from school to school, from district to district. We know that we have a 1-month trial run with a hybrid of in-class instruction as well as virtual instruction. And I think we're going to see a lot of that throughout the school year, certainly at the senior levels. When it comes to primary education, that's a different kettle of fish. We need to address a whole bunch of issues that have emerged that we've become aware of because of the pandemic. Connectivity in rural British Columbia is not adequate to meet the challenges of out-of-class instruction or virtual instruction. That's had an impact on the economy as well. So we're putting in place a plan to connect British Columbians in every part of the province as fast as we possibly can. We had a $50 million investment ready to go on that, or underway rather, and we need to up that to make sure that we're connecting British Columbians wherever they may live, particularly when it comes to ensuring that our children have access to educators, whether it be in a classroom or via new technologies.
Our next question is from Rihanna Schmunk.
Good morning. Thank you for taking my question. I know you've already spoken about the stress that families are feeling, but what can you say to ease the concerns of parents who are comparing today's COVID-19 case numbers to the cases back in June when kids were only going back to class part-time?
Well, we have seen a spike in cases. Minister Dix can speak to that. We had anticipated that. The more interactions we have within our communities, the more likelihood of transmission. That's why it's critically important to remind ourselves every day, and that's why Dr. Henry and Minister Dix are regularly available to put that message out to the public that we are far from out of the woods. We need to be vigilant. We need to practice physical distancing. We need to wear masks. I'm very gratified to see a sea of masks in front of me as we conduct this press conference. I was on BC Transit last week, riding the bus, passing out masks to people. Dr. Henry's meeting with transit officials at TransLink as well as BC Transit to talk about how we can ensure that there's more masks on buses and on SkyTrain. And I believe that we have $40-some million invested in deep cleaning in our schools, as well as PPE for teachers, for kids, that will get us through the school year. I can't help with the anxiety other than to say to those parents that I hear you, I feel it, but we need to work together to get through this. And that's the only way we're going to be able to ease that anxiety, is to get back into the classroom, to make sure we're making adjustments potentially on a daily basis to ensure that kids are safe, teachers are safe, and we can get back to what will be the new normal when it comes to education in British Columbia.
And did you have a follow-up, Brianna?
I do. Could you elaborate on how much autonomy individual principals and individual school districts will have in deciding how they proceed with their own reopenings for back to school?
Well, that is probably a better question asked to Minister Fleming, who's in daily conversations with the steering group and with public health officials, and not just at the superintendent and trustee level, but right down to administrators. I do know, and I'll repeat, that every school is different, every community is different, and that autonomy exists today. Were we not in a pandemic, principals, vice principals will be making decisions on the fly about how their school operated, whether it be extracurricular activities, whether it be any host of issues that we could contemplate. What's different today, of course, is that we're in a global pandemic. What's different today is that parents and educators are anxious about the future, and I get that. But we need to start towards that future so that we can amend our behavior to make sure that kids are safe, teachers are safe, support workers are safe, and that we can bring that anxiety down over time. It's August, we're a month away, and what happens over the next 30 days is going to be critical. What happens 30 days after we open is critical as well. But we have to take that first step to get this journey started.
Our next question is from Allison Hurst.
Yeah, hi, Premier. There was a letter that came out from a number of dentists and doctors, and they were talking about masks with young kids, and specifically some of the science. There's this gray area in terms of ages, certainly, but they've been saying that kids age 10 and older can transmit similarly to adults. So I guess I'm just wondering if there's any looking or studies going on that maybe masks may be mandated in schools.
Well, we're certainly providing the PPE for schools, for kids and for those that are working within the schools. On the research, I'm going to defer to Minister Dix on that, and maybe you can fill that answer in.
Well, just to say on the research, the actions that we're taking in public health, the decisions that are being made are all based on that research and on the direction of public health leaders, leaders such as Dr. Lee, leaders such as Dr. Bonnie Henry. And so all of those issues, and you'll recall in the restart in May, and there was lots of anxiety and lots of discussion then, we talked about the hierarchy of measures that we would take, and physical distancing is at the center of that. And then there are environmental controls, which are things such as plexiglass barriers, and there are rules such as the fact that we don't allow gatherings of more than 50, and masks are on that list, but they're below that because they have extraordinary value, and we know that, and that's why when Dr. Henry shops for groceries, when I shop for groceries, when the Premier shops for groceries, we're wearing masks. But they're not more important than those other things. So we're going to continue in this area, as in all others, to follow the science. And one of the strengths of our response, and this is something from the top, from the Premier on down, is a willingness to take information, to take new information, and to change if we need to change. We have led in British Columbia in our response to seniors care, in our response to surgical things, but those decisions required enormous effort and work, and they were all founded on scientific principles, and that is why for the most part, they're succeeding. The decision to allow visitors is succeeding because we followed the science on these questions. So with respect to new evidence, with respect to masks or any other issue, we're going to continue to follow the science and make decisions that make sense here in BC. This is our pandemic in BC, but we're in a sea of COVID-19 everywhere else, including in Washington State and in Alberta and other jurisdictions. So we've got to continue to make decisions based on the science, and we will.
Allison, do you have a follow-up?
No, thank you.
All right, we have time for one more question today. It's from Lisa Eusda.
Hi there, Premier and Minister Dix. You just talked about this idea of not allowing gatherings more than 50 and following the science. And going back to parents, I think they're confused and concerned because what they're hearing is we've been told for months that we need to keep our distance, stay outdoors, and don't be around other people for long durations. And that's the science. That's what the science is telling us. But now parents and teachers are being told, go indoors, be in groups of 20 minimum, if you're with a class for a day, and be there all day. So I think people are just not understanding this. They're not understanding how transmissions are not going to explode when we're doing the opposite of what we've been told to do for 5 months. And I'm wondering, Premier, if you can talk to that message, because people obviously aren't hearing what you're saying about that this is like the safest plan going forward and is still grounded in science.
Well, thank you for the question. And it is, as Minister Dix just said in response to the last question, new evidence will take us in new directions. Where we've been successful in British Columbia is that we have deferred to those who know better than we do. And British Columbians have responded very positively to that. Other jurisdictions have had a different approach to communicating how we respond as a community to this extraordinary challenge, an unprecedented challenge. And going back to class in September will be an unprecedented challenge as well. But I'm as confident as I can be, based on the information I have today, that every effort to get this right is being made. And we can draw parallels to other activities and try and bring them back into a classroom context. But I want parents to know that we would not be putting their children at risk if we thought there was an overwhelming risk. We believe that based on the work that's been done in the schools by all of the stakeholders, teachers, those that support special needs kids, those that keep our schools clean, administrators, support staff, everybody is focused on making sure that this is a success. And if there is new information as the summer progresses, as we get into the first days or weeks of the school year, we will amend and adapt. And I want to also reiterate that the issues in Saanich are not the issues in Selmo or Salmon Arm, and every community will have to respond differently. And that autonomy, which was one of the questions asked earlier, is very much there. It is in a normal circumstance. It certainly is during a pandemic.
Lisa, do you have a follow-up?
And another one about school. Parents feeling like they're between a rock and a hard place. The education minister was clear that the choices are go back to full-time in-class school. You can just keep your kids home, I guess, and wait it out, or pull those kids out of the catchment and do distance or homeschooling. And for many, this feels like no choice at all. So will there be an alteration to allow parents who either have kids who are immune compromised, someone in their family that is immune compromised, who are just not comfortable, but don't want to put their child out of the catchment and do want their kids to have some means of learning with the other students at school remotely?
A very, very good question, because as you highlight in the preamble, as I've said, every school is different, every family is different as well, and people will have to make choices in the best interest of their family unit and their community, and I respect that, as does the minister, as do all of the stakeholders in the K-12 system. Working with public health officials, working with professionals in education, we're hoping to do our level best to make sure the vast majority of British Columbians are comfortable with the start of the school year. There will be those that you've identified that have obvious, legitimate concerns, and we need to be mindful of that. And I know the minister is, and will continue over the next month to hear from those British Columbians and make amendments as needed to make sure that their interests are addressed as well. And before we sign off, I just want to come back to the original announcement, which is the new cancer center here at the new Surrey Hospital, and just how proud I am of how hard Fraser Health officials have been working to make this a reality. We did have land available to build the second hospital. It was sold by the previous government. There was no plan. In a very, very short period of time, the people of Surrey, the people of Fraser Health have had the Fraser Health Authority respond by not only coming up with a concept plan for a new hospital, finding a location for that new hospital, but also adding a state-of-the-art cancer clinic to a brand new hospital. It's an extraordinary story. I'm very proud of all of the people who have worked on this, and I want to thank you for coming to hear about that today.
Thanks, everyone. That's all the time we have.